Hey everyone, Dr. Scott from Caledon East Family Chiropractic here. Today I want to talk about pain in your elbow and your forearm, specifically on the outside. There's similar problems that go on the inside, which we'll touch on, but mainly we're focused on pain on the outside of the elbow, right kind of where the bone is in the elbow when you bend your elbow, that bone at the bottom there, and will often stream down your arm a little bit. This is often referred to as tennis elbow. You definitely don't need to play tennis to have it. But what you're going to feel with this type of condition we're talking about is pain to really grip things, lift things up, especially in trying to lift something up like this, twisting your arm, holding things out to the front of you to the side. And it can be quite uncomfortable, it can be quite painful and limiting for people. So stick around, I'm going to go over what that problem is and things that you can do at home to help yourself out. So this type of pain we're talking about, yes, the pain is at the elbow, but is the problem with your wrist extensor muscle. So extension of your wrist is this motion, bringing it from down to up. And if you can see when I do that, you can see if I zoom in a little bit, as I come up, you can see the muscles sort of bulge up and down as we do that. Your wrist extensor muscles they come from a common tendon in your elbow, right where that's a common tendon is where the muscle attaches to the bone, and they run down and they run all the way to the tips of your fingers. So one way you'll often test is to see if you have this type of problem. If you hold your arm out totally straight, fingers out, push down your middle finger and try and resist it, and sometimes the one beside it, but often the middle fingers will bring out the most discomfort, and you'll feel that pain right back at your elbow. That's a good indication that your wrist extensors are involved in this problem. When this type of problem is in its newer, or what we call acute stage, meaning it's fairly recent for you, a week or 2 weeks, there can often be inflammation in it. So one way you can treat it is putting ice on it 10-15 minutes at a time, a few times throughout the day to get the inflammation down. As it's been more of a prolonged issue beyond the inflammatory stage, you're going to really want to do some work to stretch it and definitely strengthen. A lot of the research shows that tendon problems like this respond well to strengthening and rehab as long as it's done properly. So the goal of this video is just to show you ways you can manage it at home. We're going to go through some sets of different stretches you can do, different exercises you can do to help manage this problem. As mentioned, if it's early, it's acute, it's quite painful. Ice is always really good at getting the inflammation down, and obviously resting and avoiding early on activities that really seem to set it off or make it worse as best as you can. When it's been a little bit longer, we know we need to start to strengthen, we need to start to rehab it. I can help you with that. With anything that we teach you in any of these videos, always use your best judgment, check with your healthcare provider, and if anything is aggravating or making it worse, definitely stop and make sure you follow up with a healthcare provider best suited to help you through these problems. So anytime you're going to work on muscle tendon problems, one of the first things you want to do is always get it a little bit warmed up, a little bit of blood flow, a little bit of heat in those muscles, because it's going to respond better to what you're doing. So a really easy way to warm up anything to do with the elbow pain and these wrist extensor muscles, just hold your arm straight out in front of you, and all you can do is just do some mobilizations where we just come up and down. Nice and easy, you know, five or so in each direction, maybe a couple more, a couple less, depending on how you're feeling. Shouldn't be painful, just enough that as I come down, I feel a nice pull here, and as I come up, you know, I feel just nice motion through my wrist there. My elbow is staying straight. Once you've done that, you can switch and you can go side to side. This is called pronation and supination. This also works those forearm muscles. So again, about 5 or so in each direction, just to get everything loosened up. The next thing I like to do after I've done a couple of those mobilizations is to give a nice stretch to those forearm extensors. My favorite stretch is to get your arm straight out in front of you. I like to put a finger above and a finger below my knuckles, like this, because what I want to do is I'm going to pull my wrist down, but then I also like to give a little overpressure on my fingers as well. So as you can see, this gives a bit of a stretch through the forearm extensors, and then as I put a little bit more on my fingers, because those tendons run right to the tips of your fingers, you get a little bit of extra stretch to those muscles. So you can hold that for a good 30 seconds or so and do that 2 or 3 times. And to get a little bit more, I'm just going to swing to the front here. As I'm holding that position, if you rotate your wrist outwards, away from the midline a little bit, push your fingers away from the midline, you're going to feel even more of a stretch through your forearm. You're probably not going to feel it right back at that sore spot, but remember, that sore spot is coming from all these muscles in your forearm. So by stretching them out, you are starting to loosen that muscle and those muscles in that tendon. Another thing that you can do at home to help loosen the muscles up, mobilize that soft tissue, is using different instruments to help loosen it up. In the office, we often have something, a tool like this with sort of a sharper edge, but not sharp enough that it's going to cut your skin. At home, you can very easily use a spoon. You can use a butter knife, not the sharp edge, please, you don't want to break any skin, but just the edges here, just to work the muscles out, break up any of that fibrotic tissue that's in the muscle and help loosen the muscle up. So the way you mobilize the tissue using the instrument is you just take any skin lotion that you have that you're comfortable, you're not allergic to, just to create a bit of a sliding surface on top of the skin. So I'm just going to take a little bit here, rub it on my forearm, grab my instrument. So you can use a spoon. If you are going to use a knife, because I've seen a lot of people do this and they quite like it, I usually wrap something around the sharper end and use the not so sharp end to do it. But a metal spoon works fine. You can use either end. I prefer to use this end. And all you're going to do is just gently, a little bit of pressure going on the fibers of the muscle there, and you'll feel kind of these little lumps and bumps. You'll feel some tender spots. And you just spend about 30 seconds to a minute or so just going up and down the muscle. Don't dig on the bone. You hit those tender spots, work them out, but don't go crazy on them. Okay, it actually can be quite helpful. I find it feels quite good after this. I've had this problem on and off before, and I find this quite helpful for me. Now that we've done some work to help loosen the muscle up, mobilize the soft tissue a little bit better, these tendons, these tendinopathies respond really well to strengthening stability work. So the way you're going to strengthen this muscle is you grab a weight. You can use a soup can, a 3-pound weight. I mean, depending on your strength and your comfort level, you don't need to be anything heavy. 1 to 5 pounds is a term that we'll often hear with these. But I'm going to use just this bottle of BioFreeze here. You know, it's probably about 1 pound to 2 pounds. And what you want to do is have it so your wrist is just at the edge of a table or a surface there, so that your hand can flex down. And all you can do is just gently elevate as much as you can. Straight from the side, a little bit more here. So as your wrist comes down, you're just going to raise it up as far as you comfortably can. You're looking to do about 10 to 15 repetitions or so, maybe 3 sets of that. Enough that you start to feel the muscles having to work, but not enough, again, that it's really aggravating the pain. A little bit of mild discomfort is okay, but it shouldn't be excruciatingly painful, and it shouldn't be to the point that when you're done, you're really sore. Just enough to start to stress that muscle. Another way we work on strengthening or rehabbing our muscles is something called an eccentric contraction or a negative contraction. And what we mean by that is if we take a weight here, you guys all know what a bicep curl is. So for my bicep, when I curl up like this, that's a concentric contraction or a positive contraction. We're shortening the fibers of the muscle and we're positively contracting it. However, when I put the weight back down, I'm still using the muscles, they're still contracting to lower that weight, because if I didn't, it would just flop to the floor really quickly. So we're still using that bicep muscle to lower it, and that's called a negative contraction or an eccentric contraction. So the way we're going to do that eccentric or negative contraction for our forearm is we go back in our same position. We let the wrist flex, the weight hang down. What you're going to do is use your good hand to elevate the weight all the way up, and then slowly, with about a 5 count, slowly lower this weight all the way down. So again, I'm still contracting those forearm extensor muscles, but nice and slowly lowering the weight in a negative fashion. So again, use the good hand to lift it up, the slow hand to slowly lower it down. Just like that. Again, your 10 to 15 repetitions, 1 to 3 sets, depending on your level of tolerance and the discomfort that you're in. So those are some of the basic exercises that you're going to see when you look up tennis elbow, lateral epicondylitis, wrist extensor, exercises, how to alleviate pain. Those are the common things you're going to see. There's a couple of other things that we need to consider though. One is our radial nerve. So your radial nerve is a nerve that starts from nerve roots in our neck, in through this part of our arm. Those nerve roots come together to form 3 big nerves in our arm. And one is the radial nerve, which runs down the back of your arm and runs right across the joint, right through the middle of those forearm flexors. So it supplies all those forearm extensors, and it's often irritated and can be part of the pain, or at least influence the healing. So we want to make sure that there's no stress or tension on that. And the way we do that is through something called nerve flossing or nerve gliding. So when you think of your dental floss, right? If we take one end, we pull on one end, relax the other end, pull on this and relax this end, and we get this gliding or flossing motion, just like you're flossing your teeth back and forth. So we want to do that with the nerves. Nerves don't want to be fully stretched, but they respond well to this gliding motion. So the way you're going to do that for your radial nerve is you take your arm and you're going to flex your wrist and just put it behind you a little bit. And while you're doing that, you're going to tilt your ear towards the same shoulder. And then as you bring your ear to the opposite shoulder, you're going to bend your arm up. And we just kind of do this back and forth motion 10 to 15 times. Okay, I'll just show you from the front here. So again, my wrist is back behind me. I'm going to bring my ear towards it. As I bring my ear away, I'm going to flex my arm up. Yeah. Just nice and simple like that. And that takes the nerve and gets that gliding motion, which can help really take some tension off it, make sure it's working properly, which will help healing through those muscles in your forearm, especially your wrist extensors at the elbow. One thing that's often forgotten or overlooked when it comes to tennis elbow type problems is the role that the shoulder and the shoulder blade and your posture really play into this. A lot of research shows that improper mechanics up here will create more stress through the elbow and the wrist as you're doing your different workouts, different daily activities. So really focusing on getting our posture right and working on some of those stabilizing muscles is crucial for long-term rehab and making sure this problem doesn't come back or happen again. We've done other videos here on a lot of the strengthening exercises to really work on strengthening our mid and lower traps, rolling our shoulders back, working on the rotator cuff and our external rotation. A little beyond the scope of this video to get into all those exercises, but definitely go and review some of the other exercise or the other videos we've done that talk about your postural exercises, because stabilizing this long-term will really help with healing and preventing this type of injury. So if you are suffering from pain at the point of the elbow, pain to grip anything, lift your weights up, especially in this manner, really good chance it's a tennis elbow or lateral epicondylitis, which is an issue with the tendon coming from your wrist extensor muscles, which are the muscles that run from your elbow to the tips of your finger that move your wrist in this direction. If that's the case, initial ice and rest when it's acute, then we want to work on our soft tissue mobilization, work on the stretching that we showed you, progressing into the strengthening exercises, as well as making sure that radial nerve is freed up and can help with the healing process. And then long-term, working on our posture to take stress off of those tendons to prevent this from coming back or even prevent it from happening in the first place. As always, I certainly hope you found this video helpful for you. If you have any comments, questions, drop them in the comment section below. We always love to hear from you on different ways that we can help you out. And feel free to give the video a like and subscribe to our channel as our different practitioners put videos out each week or so to help you stay healthy and active and living your best life. Until next time, we'll see you soon.